Hello and welcome to the Valley. Today I am your host, Janet Michael. I am back at Winchester Medical Center campus at Valley Health. Across the table once again from Chris Rucker, Chief Administrative Officer for Valley Health. Chris, we talked a week or two ago, pre-legislation passing. It has now passed. So what do we do? Where are we now? What happens next?
Well, welcome back. I'm glad you came back, and we're talking so often. Maybe I'll get my own orange microphone soon. Well, you're right, it did pass. And as we shared, it's going to have far-reaching effects in our community. We remain very concerned about how we will care for the needs of the 500,000 people that we serve in Valley Health's area from our 6 different hospitals and clinics, etc. But on the other side of that, Valley Health has been around more than 120 years.
You've weathered many a storm in that time.
Many a storm. We're resilient. We're a financially sound organization. We're not racing to make any significant changes. And I will say that in part is because even though the bill passed, there's a lot more to be figured out at the regulatory level, where the government departments then figure out how to implement the law. For example, there's a work requirement that people must revalidate every 6 months that they're working a minimum of 80 hours a month, essentially part-time, if they're able to work. But the specifics of what forms they fill out, where they go, how they validate that employment, do they show a pay stub? There's a lot of details in that, and even small things like that can have a significant impact. If, let's say, you live in Romney, West Virginia, and you must come once every 6 months to Winchester to wait in line at the Social Security office to show them a pay stub, and you don't have transportation, maybe that would be difficult and you'd lose your Medicaid. So those are the sort of scenarios that we're turning around in our heads when we're thinking of all the different ways this is going to impact our community and our patients.
One of the questions that I was asked after our show aired a few weeks ago was, so if this bill passes, are we going to see the impact the next day? I said no. I hope that was the right answer. But what you're saying is true then. So it's going to take some time to basically work its way through the system. And it could look a little different, but it's not going to look a lot different.
Yeah, you're exactly right. It's not going to look a lot different. And hopefully it's not going to look a lot worse. The bill does phase in various new standards over the next several years. So there is a phase-in period. And also, as I said, Valley Health, we're a financially strong organization. We don't need to be immediately reactionary, but we have already started thinking about what those different levers are that we can pull. Ultimately, what we want to assure is that patients in every part of our service area have access to care, that they have access to a physician, and that we're caring for them in the most cost-effective and accessible location to them.
We talked mostly about the Medicaid portion of that bill. Last week I had a conversation with Andrea Cousins from Winchester CCAP. We talked about the SNAP benefits cuts. Valley Health also make sure through your community grants, through all the other things, that people have access to things that ultimately will impact their health care. So these Medicaid cuts aren't the only thing. They're going to impact your patients and your clients in this area. You're also concerned, I would assume, about SNAP benefit cuts and all the other things that were included in this bill, because it's going to have an impact on the overall health of everyone in our area.
You're absolutely right. So SNAP, if people didn't listen to your program 2 weeks ago, is supplemental nutritional assistance, and it helps low-income families stretch their dollars at the grocery store and continue to put food on the table. And that falls in the realm of what we call social determinants of health. And if we think about the many factors that impact our health, things like employment, like literacy, like access to healthy foods, those are all essential parts of that foundation of healthy living, of wellness. So it is essential. Housing, employment, on and on, many other social determinants. It is essential. And so SNAP is a concern. Another example of something, everybody's thought of this as the Medicaid bill, but another example is The Affordable Care Act provided assistance to people, low-income people who didn't qualify for Medicaid, but it provided assistance for them to purchase health insurance in the health insurance marketplace.
A lot of those in the Alice population, they made too much, $1 or two more to
Right.
qualify for Medicaid, so they needed to find other options.
Yes, the asset limited, income constrained, employed Alice population. It was where they would turn to purchase their health insurance. The subsidies for that also are going to be phased out. So we talk a lot about Medicaid, and that's a huge concern for us, but as well, this is also reducing access to health care for those Alice population members that are purchasing insurance on the healthcare marketplace. SNAP benefits, another example, as you mentioned. So all those things in total really impact the health of the community and the access to healthcare.
Do we as a population now just have to resign ourselves to this is our current situation? Is there anything that we can still do? Are there things that we should be more aware of now that this actually is a passed piece of legislation?
Yeah, it's a great question. No, we should not resign ourselves to these circumstances, but it is a reality for the foreseeable future. But we should not resign ourselves to it. I think it's important still that our elected officials hear about some of the challenges that this is going to cause. Elected officials need to know if members of the community who are employed are not able to prove that employment, or those who lose their subsidy on the open marketplace, the insurance marketplace, lose their insurance. So no, this is not a time to roll over and say, okay, we'll learn to live with it. But it is a time to continue to share those concerns with the people that we sent to Washington to represent our interests.
There were a lot of misconceptions about what was in this bill. I think now that it has passed, it's going to be a little bit easier to knock some of those down. Like I heard so many different crazy stories about, oh no, only the people that are not legal residents, not legal citizens of our country are going to be taken off of Medicaid. That is not the case. It is much more far reaching than that. You mentioned when we talked the last time, a lot of these are the elderly people. They are moms with children. It really was everybody. And I think that's a good point to dwell on a little bit longer so that people understand and realize, no, that's not what it was.
You're right. I think there were a lot of misconceptions. Those misconceptions continue. We all get our news from different places and read different newspapers and watch different news channels. And some of them are better at informing us of what the anticipated changes are. And also things like social media are just a great way to spread misinformation, and that can be very misleading. It is a fact that there are people who believe this was a good bill who are going to lose their health insurance, and they don't understand that yet.
The only thing people should be watching on social media are cat and dog videos. Let's be honest.
Absolutely. Cat and dog videos and the occasional stupid human trick.
Well, there is that. Yes, those are always ideal. Another question, and I was surprised by this one. Another question someone asked me after our show aired was, so does this mean that Valley Health is going to consider closing some of the hospitals, or they're not going to be able to support some of the free clinics to the degree that they have before? And I didn't feel comfortable answering that, though I did say, oh no, I'm sure that's not the case. But I'm hoping you're going to say, no, Janet, that's not the case.
Well, I won't say, no, Janet, that's not the case. I won't put it in those words, but I will say we remain committed to the population, to caring for their needs. And again, Valley Health has been around for 120 years, more than 120 years. We'll weather this storm, but not without changes and not without some difficulties along the way. Closing hospitals, probably a last resort that we haven't even begun to contemplate.
We heard a lot of that on the news shortly after the bills passed. But I think people hear that, and then they've heard us talk about rural communities, and are like, oh no, could I lose my hospital? So I just wanted to make sure people didn't run all of a sudden thinking, Winchester Medical Center is going to close. No, no, it's not.
No, it's not going to close. People can count on Valley Health to be their healthcare resource. Some of the discussion when people are talking about rural hospital closures, those are often independent rural hospitals that maybe were originally started by the county government or some independent organization or a hospital district. Those that are standing alone and are not part of something larger are the most at risk. And so those are the ones that have potential for closing just because they will feel the effects very quickly. Valley Health, we've put some money in the bank for a rainy day, and we've built a strong reputation and a strong management team to be able to lead us through that.
It really is a benefit that you have this entire health system. You're not just this one hospital that is dependent on maybe a particular source of income. You've got hospitals across the state lines, even in all these different communities, and you don't get that way by not planning ahead and saving for that rainy day.
Yeah, you're absolutely right. And to the point about all the hospitals, and you asked a minute ago, is it possible that Valley Health would look at closing hospitals? Keep in mind, we would still be responsible for the care of all those people that used to go to that hospital. So it's not necessarily...
If one closes, they're going to go to the next closest one.
Yeah, and it sounds like the easy way out, but that's not necessarily the solution that would work.
We're going to take a quick break, then come back and wrap up our conversation with Chris Rucker, Chief Administrative Officer for Valley Health, about the impacts of the now passed legislation that will remove millions from Medicaid and SNAP programs, as well as many other social safety net programs. In just one day, you can help shape a stronger, more connected community. On September 19th, United Way of Northern Shenandoah Valley will lead Day of Caring, the region's largest single-day volunteer event. Over 900 volunteers will roll up their sleeves to help local nonprofits with projects that matter. Painting classrooms, repairing shelters, planting gardens, organizing food pantries. Whether you're a business looking to sponsor, a nonprofit in need of an extra set of hands, or a neighbor ready to serve, there's a place for you on Day of Caring. This is what community looks like when we come together. This is care in action. Learn how to get involved at unitedwaynsv.org/dayofcaring or email dayofcaring@unitedwaynsv.org. One day, hundreds of hands, lasting impact. Join us. Welcome back to the Valley. Today, I am your host, Janet Michael. I am back on the Winchester Medical Center campus for the show today to get a What Happens Now perspective from Chris Rucker. Chris is the Chief Administrative Officer for Valley Health. We talked a few weeks ago prior to the recent legislation being passed, with Virginia Senators Kane and Warner voting no and Congressman Ben Cline voting yes. So I wanted to know what happens next. In the final part of our conversation, we talk about the impact of the cuts to our localities regardless of their relationship to Medicaid. We talked about what that trickle-down effect is going to be as we move through this bill's passage. People need to start also understanding when they're in an emergency room and it's taking a little bit longer maybe to be seen. It's because some of these patients no longer have access to their primary care doctor because their Medicaid is gone.
That's right. And for them, they may be using the emergency room as their primary care, or their illness has gotten to a point that they need to come to the emergency room, but it could have been prevented if they had primary care and preventative care and access to medications.
We've talked about that in the past across multiple Valley Health shows that I've done over the years, is just the preventative nature of keeping somebody from getting to that critical point of needing an emergency room is so important. Medicaid fills that gap. Medicare fills that gap too in a lot of ways. And now that gap is getting bigger and bigger and bigger. That's an outcome of this bill.
You're right. At Valley Health, we're a nonprofit organization, tax-exempt organization chartered by the community to provide health care. And that includes to those who can't afford to pay for it, who don't have insurance or who don't have income or who are unemployed or are homeless. Private healthcare providers in the region, independent physicians and drug stores and physical therapy offices and these other healthcare providers, we're not the only healthcare provider. They're a private business. They're not necessarily looking to have patients that can't find a way to pay them. So there will be a shifting around of patients and those who are responsible for them that'll sort of settle out. Another thing that we haven't talked about when we talk about trickle down is the effect on employment and the economy in general. These healthcare dollars can also be looked at as investments into the local economy. So if you take an organization like Valley Health, if we have $50 million less a year coming in, we're going to build fewer buildings. We're not going to replace or update buildings as often as we currently do. And that means some construction workers won't have the same employment that they had, or an architectural firm won't have the same, or a plumbing firm, or all that sort of stuff. We spend tens of millions of dollars with local businesses every year, and that has an impact. If we have fewer employees, then that's less payroll dollars going to the grocery store and the babysitter and the car repair shop and the gas pump, and those are all places where it ripples through. And then let's say the grocery store, I said that, so if we're not spending as much at the grocery store, then the grocery store can't afford as many clerks, and so they don't need as many folks stocking the shelves, and on and on. And it sounds a little bit far-fetched in some ways, but $50 million is a tremendous amount of money to pull out of a community the size of Valley Health.
The other side of that trickle-down problem is, say you have a single mom, and she had Medicaid, and now she doesn't, and she gets sick. She doesn't have a doctor that she can necessarily go to, so where she could have made an appointment, gone to see her doctor, gotten some sort of medication, and she was better in a day or two, now she's going to have to wait that illness out. If it's the flu, if it's COVID, if it's any number of things, and she's going to miss 5, 6, 7 days of work. Now that employer is missing an employee. She's now not getting paid because she's not working. She can't now cover daycare costs. There's a human side to this that I don't know that a lot of people really recognized as this thing was working its way through the system.
You're right. In many ways, we looked at it really at a very high level. And again, as I said earlier, we thought of it as a Medicaid bill, and it certainly is an essential and central part of the bill, but the impact is much, much greater. And many of the Medicaid recipients work in employment that doesn't necessarily have paid sick time or allow them to take time off, or necessarily feel obligated to continue to employ them if they're missing work.
That was part of, again, my conversation with Andrea, that so many of the people that she sees through the food pantry portion of Winchester CCAP have 2 or 3 jobs. None of those jobs offer health care because you're not working your 40-hour a week in order to qualify for that. So you miss a day of pay, and that, again, comes back around at some point.
Yeah, 1 day of pay to somebody who works full-time is 10% of your paycheck. And there's not a lot of folks that can take a 10% bite out of their paycheck several times a year, in the example you gave.
Okay, so give me some good news. Tell me something good, Chris.
Some good news is every day there are healthy babies born at Winchester Medical Center, and those young people will grow up and take care of us when we're old.
One would hope.
And one would hope. That is the good news. And when we talk about this, I think it's important that I put it in the most raw and straightforward circumstances, but it is not intended to be alarmist or hyperbole. I want to emphasize that, again, Valley Health is committed to serving the community. Our mission is serving our community by improving health, and we're going to continue to live that mission in everything that we do. But we're going to have to think differently about how we deliver care.
Thank you for taking the time to reassure me. I appreciate it.
You're most welcome. Thank you.
Well, that's it for us today. I'm glad Chris wanted to wrap up with something positive, because it is not a happy picture moving forward for thousands in our communities. But remember, your voice still matters. Use it to communicate with our elected officials. Use it to communicate with your circle of friends. Use it to reach out to local nonprofits and ask about advocacy, about volunteering. Your voice is one of the most powerful tools you have, so please use it. I'll be back tomorrow with a brand new episode of The Valley Today, just a few minutes after noon.